Unplugged Series by Dr. Naresh.
Today, I have a very special guest, Dr. Naresh. Dr. Naresh is a dental surgeon, an entrepreneur, and Dr. Naresh will be remembered in world for being the pioneer of a B2B dental platform called Platix. This Unplugged Stories will today uncover his journey from being a dental surgeon, leading a hospital as a CIO, and the current march as an entrepreneur for the B2B dental platform. Welcome to Unplugged Stories, sir. So, Dr. Naresh, you started your journey as a dental surgeon, then you moved towards health informatics, and now you're an entrepreneur for a leading B2B dental practice platform. So, can you please tell us that how did this journey all started, okay, and how the current journey looks to be?
Well, Vishy, to start off with, after graduating in dentistry in the year 2002, quite a few years back, practiced for a few years in Hyderabad. I was working as a dental teaching hospital in Hyderabad, where I was exposed to some of the latest technologies which dental students and the dental professionals used to use. So got interested in learning how to use them, what benefits which we as dentists could see, as well as what benefits which patients can offer. With that in perspective, I started to drill down, is there a field which can revolve around such use of technology in dentistry or in healthcare at large? That's where I got into health informatics. At that particular point in time, I had few mentors, Professor Khalid Modu, Dr. Tanga Prabhu, Dr. Bhattacharya, who were kind of moved from their successful medical careers into health informatics. Got in touch with them to understand what the field is all about, what career prospects are there, and then felt, it is really good to get into such new career, being from a clinical background. That's where I had decided to go abroad to do my master's in healthcare informatics from City University in London. That gave me a different perspective of how to use kind of technology into the healthcare space. That's where I did my post-graduation and then shifted my career from being a dental surgeon to a healthcare IT professional.
So, Dr. Naresh, you went about studying health informatics 2 decades back, okay? And how was that particular transition of yours from being a dental surgeon, studying in an advanced country which has got health informatics in practice, and how did your journey looks like when you might have come back to India, how it got implemented, how does the 20 years back history looks to be, and how the current scenario looks to be as a CIO?
Sure. So I think the health informatics career as an industry was evolving about 2 decades back. India was getting to see the advent of technology being used, especially in the private healthcare setup. But my master's program in the UK kind of gave me a different perspective in terms of how healthcare is evolving across the world, and where people and how people are using technology to benefit both the clinical community as well as for the patient's perspective. Once I finished the master's program, I came back to India to work in some big technology companies. Working in those technology companies gave me an idea how do we conceptualize, design and develop those IT applications to be used in the healthcare system, both in India and abroad. And as well as moving back to hospitals from there. Hospitals are a different beast altogether. The processes, the people, the culture, etc. is quite different when you compare it to the technology companies. So having such experience and knowledge from an educational standpoint gave me a vantage point in terms of how do we kind of design and implement technology systems in hospitals, especially in India. Having worked in some of the biggest hospitals in India, KIMS hospitals, Continental Hospital, as well as Rainbow Children's Medicare, which was the latest stint, what I have kind of realized is technology has a huge role to play in the way healthcare is delivered in India and abroad. We have seen what COVID has done in the quite recent past. It has changed, it has taken Indian healthcare to a different trajectory. People have realized the role of technology which can play in saving people. And now in 2025, we are we are in a stage of quick commerce, right? Everything is in a quick commerce mode, right? The convenience is what matters for everybody. Whatever you want, we can get it in quick 5-10 minutes time. That's what the quick commerce industry has taught us. And obviously healthcare also is kind of waking up to that, and patients are demanding such sort of healthcare services at a quick time also. So the only possible way in which we can offer such quality care to patients is the adoption of technology in the healthcare space. Well, Vishy, one important parameter which I would kind of re-emphasize is the whole discipline of health informatics is how do we digitally transform an organization, a healthcare organization, be it a small OPD clinic, be it a nursing home, be it a multi-speciality hospital or a tertiary or a quaternary care center. How can technology really transform an organization into being patient-centric, being doctor-friendly, being friendly to all people who are working in that organization? One thing to remember is it's a journey which an organization has to take. It will not happen overnight. It will not be a quick fix, and technology will not solve all problems which an organization has. Some of the mistakes or some of the learnings which I did over the last so many years of implementing technology in hospitals is that some people believe that it's an IT project. Any digital transformation project is an IT project. An IT team is responsible for doing it, and no other business is involved in doing that. That for me is a non-starter. And eventually the projects which have been done in that mode will obviously not see a success in terms of its usage, in terms of its benefit for which it is being implemented for. A digital transformation in an organization is a joint effort. It's a joint effort between IT, of course, but the business teams who are also part of the overall ecosystem in implementing technology in a hospital. That's the reason when you compare it with other industries, there are digital transformation offices being directly driven from the CIOs or the management or the top management's office. It has to be a top-driven approach. A bottoms-up approach will never work in my experience if you want to really transform the organization. Second, we have to always have patients as a central focus point and revolve technology around it. Many of the times what people feel is that just implement technology and people will fall in place, which is a very disaster for me. Right? We have to have patients in focus and then understand what their problems are, and then weave technology solutions around it so that patients are benefited, their care is improved, as well as from a management perspective, it helps them to easily manage the hospitals better.
So my question would be like, so you've been a CIOs for KIMS, Continental, Rainbow, and the CIOs are the core role of the digital transformation, which I go back to 2 decades back. It looks to be more from getting the operational efficiency, though it is the patient isn't kept in the mind, the finance, material management part of it. In your CIO role, were you involved in the medical informatics part of it, the clinical workflow side of it? How your experience has been in that field?
If you look from an industry perspective, the way digitization has happened in hospitals, first is there were just billing systems in which we could kind of bill patients. Second stage was where we integrate different departments in a hospital. You know, your operations, OPD, IPD, you have a nursing counter, etc. You kind of integrate all these hospitals into a hospital information system just to improve the flow, improve the efficiency, etc. Third stage is what the clinical systems have come into being. You call up the electronic medical records, the clinical decision support systems, the apps which we give to doctors and nurses. This is the stage where we are trying to implement technology at the hands of the clinical community to help them. What I would say emphatically is that we should not look at technology being a replacement tool for the clinical community, right? The electronic medical records or the clinical decision support systems or the nursing portals or the doctor apps, whatever we build and give it to the people, are there to help them to do their job easily. And technology is always an enabler to help them deliver better care rather than they don't replace them at all.
And Dr. Naresh, when I was looking at your resume, again, some close to 10-15 years back, you worked with 104, okay, and very prestigious HMRI, if I'm not wrong, right? So that's a telemedicine platform. and I've been also listening to telemedicine at least from 1998 from the Hyderabad. How this telemedicine has evolved? Does it still remains that two people getting connected, or what we really get to hear about tele-ICU, tele-radiology, the AI-based ICU, is that really in place, or still we are backward?
Telemedicine as an industry, the way I see it is, if you take from an Indian context in perspective, Indian healthcare needs are quite diverse, right? The advantage of we being in a metropolitan city, we are able to meet any super specialist we want by just walking into a hospital, taking appointment and meet a super specialist. Unlike in other countries, other countries there's a defined process. First you meet your general practitioners, they treat you. If the patient is not getting well, there's a process in which you are referred to a super specialist. But in India, you have the comfort of meeting a super specialist. But this all happens in the metropolitan areas. But if you go to tier 2 and tier 3 cities where there are not so many specialists or specialized doctors who are available, how do we kind of treat them, right? They cannot be treated by just visiting a general practitioner. That's where the role of technology comes in, right? The big 3 A's of healthcare, which is availability, accessibility, and affordability. If you put telemedicine as a bottom layer, it really helps solve all 3 problems. But it has evolved over a period of time, from initial connecting two people over a network. From there, we have, as Vishy said, we have seen the latest technology tools being implemented, the tele-ICU, the AI-based radiology diagnosis and treatment planning. It has quite evolved a bit. But the only challenge I see in telemedicine not taking off in the Indian context is who will foot the bill. Right? Now that insurance companies don't pay for telemedicine consultation, it is completely out of pocket. And obviously, if it is out of pocket, if patients are not able to pay for telemedicine consultations, then the technology is good, but the adoption rate will not be successful, is what I feel.
And do we have very strong, stringent telemedicine guidelines from a clinical practice aspect in place now? Because during the COVID, I believe we came out with some form of a telemedicine guidelines, but I believe that was more towards connecting patient and doctor. Do we have a more evolved and matured such practice, like in terms of when I refer a patient and the hospital is monitoring it, if something happens to the patient, who is responsible? So those kind of guidelines has been worked out, or still it's in that?
For me, telemedicine has 3-4 larger categories to work on. One is only the technology piece. Technology is the simplest piece in all this. Second piece is a legality around it, right? If the patient is being monitored from a third-party location, if something happens to the patient, who is legally responsible? Who is legally liable? Right? That is the second point to it. Third point it is a whole concept of patient confidentiality. Right? If the patient is being monitored or managed by a person who is not in the vicinity of care, then what information should we pass on to the person there? Okay? That is patient confidentiality. I'm happy to note that the Ayushman Digital Bharat Health Mission and the standards which have come from a government perspective really try to solve some of the problems, some of the challenges which we have. So the DPDP Act, if I would mention that, which is the protection of personal data. If you put all these into this, telemedicine could really do wonders in the way in which we've been managing patients in India. Well, telemedicine, I think, has evolved over a period of time, right from just starting off by just connecting a patient and a doctor over a network on a video call. From there on, we have seen evolve the whole concept being evolved into managing patients, especially sick patients, from a distance. Right, we have seen command hospitals being set up in tier 1 cities, and sick patients being managed at out locations, ICUs, especially in the tier 2, tier 3 cities. We have seen significant success stories by using such technology, and we have even seen AI-based telemedicine tools which can quickly help the doctors diagnose and formulate a treatment plan any time of the day, just to help them arrive at a better diagnosis. So telemedicine has seen quite significant amount of improvement in the use cases, as well as from a technology perspective, how technology can help users of this tool.
Dr. Naresh, you have led quite a few hospitals like KIMS, Rainbow, Continental. You are leading as a CIO. So my question is that what has been the most underestimated challenges when it came to the implementation of IT in such hospitals?
Well, I think Vishit, the hard reality even today is that people realize that CIOs are just there to fix computers, laptops, and desktops and printers. That's a sad part of it. But honestly speaking, the role of a CIO, what he or she brings to the table in an organization, as it could be a smaller hospital or a big multi-speciality center, is quite huge. It is just not being compliant by having an IT team and putting a person in the role of a CIO. The organization has to have that drive to digitally transform itself. Any digital transformation in an organization, especially in healthcare organization, has to be an approach, right? It cannot be a bottoms-up approach at all. And the role of a CIO has evolved quite a bit over the last few years. The success criteria, if you were asked me, how would you define a successful CIO? Is just not knowing technologies, not knowing the applications, not knowing where to implement what, but talking the business language. If you look at the leadership table, right, you have the CFOs, the CMOs, the CEOs, etc. The CIO has to have that ability to talk the business language, right? It could be both helpful to them as well as to the leadership team also. Until unless you know the business language, you'll still be considered as a person who will just fix computers. Right, so every organization has to have the person who can talk the business language, who can lead technology and really digitally transforming that organization. And in my experience, what I have seen is that until unless there's a culture of digitally transforming an organization, any projects, any implementation which you do will not be so successful. We might achieve the project, we might achieve the dates, we might go live, but the actual essence of why we are implementing such technology is only being tracked only by its usage. So until unless there is a culture which is there in the organization, any technology, any tool which you implement might not be so successful.
So what I understood is that there's a perceived notion of CIOs being a system integrator, but the reality is that they are the dashboard who brings all the other stakeholders like CMOs, CEOs, okay, and you also mentioned about the cultural part of it. So can we say that CIOs could be the right people to be the CEOs of the hospitals? Because if they get P&L and EBITDA in place.
Of course, nothing stops us from becoming CEOs. If you have the appetite, if you have the inclination, if you want to grow into those roles. But benefits what CIO would get is he or she would know all the departments, all the workflows in an organization, right? So no other role in an organization would be a horizontal role. When I say horizontal role, when you implement technology in organizations, you have to touch base with every department in an organization. So obviously you will know the nuances of running such an organization, such departments, etc. Because you've implemented, you work closely with them, right? So you understand what their workflows are, you understand what their work is, what work they do in the organization. Obviously, if you have the appetite, if you have the inclination to becoming a CEO, a background of a CIO would definitely help you grow to that role.
Dr. Naresh, digital transformation with respect to healthcare, I believe there's quite a lot to be achieved, and India is still, I believe it's still in the nascent stage. What would be your advice for the people from a clinical background to take up a career in health informatics?
Well, the way I see it, it's a very promising career. The field is growing pretty fast, and with the advent of artificial intelligence, the automation, the tools we have at our disposal, I think we have seen a very bright prospects in the healthcare IT space. But what I would suggest and tell everyone is that to get a formal education in this field, right? One is to get on-the-job experience. But if you can get a formal education in the space of health informatics, there are a lot of universities in India and abroad offering such courses at a bachelor's level, at a master's level. If you can get that formal education, it will give you definitely an edge when you get into the job market. So from a career prospects perspective, it is quite huge. You could work in technology companies which build solutions and implement in hospitals. You could get into hospitals like myself, working in departments involved in digital transformations. You can get into clinical research organizations because you have the domain, you have the experience of understanding technology. So the prospects are quite huge, both in healthcare and as well as in the pharma space.
So when we say about clinical professionals, so can we, if they need to be from a medical background, or they can be from a nursing background, they could be from paramedic or allied health sciences background?
See, once you try to shift your careers from a clinical to health informatics, there's no requirement that you need to be a doctor or a nurse to get into this role. Any domain, what matters is a domain. If you understand healthcare, if you're being an allied healthcare professional also, specializing in health informatics and getting into healthcare IT space, you could really do well once you have that formal education in place.
Dr. Naresh, can you help us to understand what are the kind of soft skills and technical skills required to be a successful CIO like you?
I think CIO, especially in a healthcare setup, is a very, very demanding role, right? We're talking about the criticality in the organization, right? Especially when you're talking about patients being taken care of in a hospital, the role is quite demanding, right? So obviously, if you want to be successful, it's not just reaching to that role. Staying in that role for a long time is what matters. And for me, I think understanding the technical bit of it is just not knowing technology and what is a coding language, etc. But once you implement such solutions, you need to understand the other technical bit of it and working in other departments, especially the ERP systems, the way Excels are used, the way dashboards are made, the way MISs are made by different organizations. The nature could be, the form and shape could be different from each organization. But you need to understand broadly what are the systems being used, why is the ERP being used, in what way the dashboards are being used, in what way an MIS is structured, right? From MIS is structured from what information which your IT systems would give you. So those are the technical bits you would definitely need to understand, have a grip on. Second, from a soft skills perspective, obviously you need to be a better listener, right? So unless you go on the ground, understand people's problems, understand patients' problems, and until then only you will understand where you could implement technology to help their lives better. Right? It is just not taking technology which is available in the market and implementing it, but you need to be a hands-on guy, lady for that matter, be on the ground to understand, listen what problem people are facing, have patience at the central focus point, and then weave technology around it.
So Dr. Naresh, is being a CIO a very stressful job? If yes, how does a day of a CIO looks like in our hospital?
As I said, CIOs are very demanding in nature. The business demands are quite huge to a CIO. Typically, I would say one is obviously strong focus on execution. A CIO is responsible, his or his team is responsible for an implementation of technology solutions. So obviously the execution is what matters. So the entire project management, entire getting people interested in the project, working together with other teams is really, really crucial. So one focus would be on project execution. Second, obviously the success would depend on the team which the CIO has. So obviously you need to have a team who could look at implementing such solutions and getting the transformation in place. So obviously the team building, being a leader in a leadership position, team building, their management is very important. Third, but not I won't say the least of importance, but which has significant effect in the way the organization is run, is the whole support system, right? We could go on buying technology and implementing it, but there needs to be a strong focus in the way these systems are supported. When I say support, both offline and online, you need to have people on the ground who could really understand what problems these technologies are bringing upon and then solving them. So our CIOs should always have a daily focus on the support tickets which are coming into the department to ensure there are no on the ground stoppages of using systems. So in summary, I would say, strong focus on execution, team building, and supporting the systems is what matters.
Dr. Naresh, the future is all about digital hospital. It's about AI, robotics, and you've been leading as a CIO for past 2 decades. Okay. Now, suppose there's a transition and you are a leader of a large hospital and you are going to select or recruit a CIO. So what are the kind of qualities you would like them to have, okay, him or her to have, to keep the digital ecosystem running in healthcare?
Well, Vishay, I think I would broadly categorize into 3-4 buckets. Obviously, one is to have a vision of making a hospital fully digital, a vision to get people along with you, a vision to manage projects in such a way that they are successful end of the day. Second, obviously, he or she has to be a business leader who understands the business, who understands the departments, how they work, understands the workflows involved. So the successful person would always be on the ground person who understands what is happening on the ground. Third, a patient listener who will understand more, who will listen more, so that he or she would get the right picture. Fourth, the person will have to bring a lot more than technology to the leadership board. Right? So he or she has to get that business inputs, which would be really good for managing a digital hospital. So I think if I were to recruit a CIO in my organization, I think there are 4 broad categories which I would look at. One, vision in terms of how do we transform the organization, how do we bring that whole culture into, how do we kind of bring the culture in transforming the organization digitally. Second, has to be a business person, has to understand the different department workflows, the business aspect to it. Third, most important thing, has to be a people person, a patient listener who can really understand and implement solutions well. And obviously, being a CIO, the person should have the technology background, understand the nuances of technology, understand where technology can help, and more important, understand where technology cannot help and should not be implemented for it to be a successful digital hospital.
Dr. Naresh, I came across a designation, Chief Medical Information Officer. How Chief Medical Information Officer is different than a CIO in a hospital setup?
Well, I think a CIO would be a more broader role, will involve not only implementing applications, but the hardware aspect of it, the cybersecurity, the networking, the whole hardware bit of it is what one component would be. Well, the CMIO role is quite evolving. It is not not that every organization has a CMIO in place, especially in India. It's a Western concept. But primarily from a responsibility perspective, I think the person is responsible for the whole medical information of a patient, right? What applications would cater to such medical informations? You could call the electronic medical record, the nursing portals, or any application where medical information is stored, right? How do we kind of standardize the uptake of medical information? How do you protect it? How do you kind of ensure that data is not leaked and protected well? Is the role of a CMIO in a hospital.
Dr. Naresh, you have over 2 decades of CIO experience. What motivated you to get into an entrepreneurial journey wherein you went about building this B2B platform called Platix?
So after spending 2 decades in healthcare IT in hospitals and personally seen where technology has kind of progressed, when you compare it vis-a-vis to what dentistry has achieved in using such technology, I see a huge gap in the way technology is being implemented and where it could really help every dental professional really benefit out of using such technologies. Platix is an application built from grounds up, built by dental surgeons for the dental professionals in India and abroad. Our idea is to bring everything on, to have one common source of truth for all professional needs of a practicing dental practitioner in India. It's not a clinic, it's not a digital marketing tool. It's a platform where you could everything you want on one single platform, right from buying materials at an affordable cost, better manage patients from a retention perspective, from a marketing perspective, and from a lead generation perspective. I think Platix is built to take the dental practices efficiently to a next level. So from a feature perspective, I think every dental professional to run a successful dental practice, it is just not using a practice management system where you can just bill the patient and fill the patient and send the patient off. You have a lot of use cases which requires you to communicate with your other important stakeholders, which are dental laboratories, the imaging centers, as well as the suppliers or distributors with whom you need to buy equipment or material. So currently what I've seen is this works on an offline basis, leading to a lot of time and effort which a practitioner has to spend to get everything in order. Right? The whole idea of building Platix is to bring all these important stakeholders on a common platform. Say, for example, you need to send some work to a dental laboratory, which is happening quite on paper and on WhatsApp, which is causing me to spend more number of time to understand which orders have gone where and what is the status, etc. So if you kind of bring everybody who are working currently in silos to a common platform, there is real-time sharing of information, both clinically and non-clinically, which could help me run my practices better. And also from a laboratory perspective, they have all orders coming in one single click of a button, which really helps them to deliver better care to patients.
And you also mentioned about it is integrated with practice management and also to do with the patient experience. So can you give us a little bit more insight? How does it differ from the other practice management tools which are there in the market?
Well, one important feature which Platix has from a practice management perspective is that it is a system which is built by dental surgeons for dental practitioners. It solves all the use cases which a dental practitioner needs as far as patient management is concerned. Just registering and billing a patient is not the end of it. Right from the moment the patient comes into your practice, the way you kind of understand the diagnosis, the treatment, what questions you need to ask the patient if he is medically compromised, what precautions you need to take if the patient is a medically compromised patient, what treatment you need to plan, how do you effectively communicate such post-operative instructions to patients using technology is all built into Platix, which I've seen not many systems in India do have in use.
So Dr. Naresh, you have your customers who are using Platix. What is the one thing they say good about Platix?
One is the whole user interface. Mm-hmm. How easy is it to use? Built on the latest tech stack, so the technology is not a problem. Third, it really syncs to the cloud immediately, which does take out the pains of installing application, using it. Fourth, and the most important, is mobile compatible. You can run your practice from anywhere in the world. You need not have a laptop to do it. It's completely mobile interface enabled.
So Dr. Naresh, how much your clinical experience and the CIO's experience helped you to really shape up this product?
Well, being a CIO, it really helped me understand the way technology should be designed and developed, especially in healthcare. Coming from a dental background, I understand the domain pretty well. That's where the combination of being a dental surgeon and a CIO kind of gave me a broad perspective of how a system should be built, what use cases can it solve, and what are the real challenges which a dental practitioner is facing at this point in time, and where we can build Platix to help those problems. So it really helped me in terms of designing and developing and testing and launching the product in the Indian market.
So while asking this question again, I was thinking that why did you got into the entrepreneurial journey? Was it like the entrepreneurial kida was there? Was it a peer pressure that let me also do it before I hit 40, 45, 50? What was the reason for you to get into this entrepreneurial journey, which is very rosy as well as difficult?
Well, it was a tough choice. Being comfortable in your job, being comfortable in terms of the career. But I always had that in me saying that, okay, there's an opportunity which I see, wanted to explore that opportunity well, and then build a platform and see where it goes. But over the last 1 or 2 years, it's quite challenging. I've never done sales in my life. So doing sales, being an entrepreneur is a killing job. So liking it, you have to be very resilient if you want to be a successful entrepreneur. Resilience is the name of the game. It's been good till now. I'm trying to enjoy the journey, and hopefully it should be successful also.
So as a wish list, suppose I'm Lord Brahma and I say I'll give you one Vardhan which you can take it for your entrepreneurial journey, other than asking investment, what it would be?
For every entrepreneur, what matters is sales. So obviously I would like sales to happen, big sales to happen. My vision is to get at least 20-30% of the Indian dental market in the next 4-5 years, and obviously go abroad from there, and then get market captured there also.
Wish you good luck, sir.
Thank you so much.
So Dr. Naresh, right now you are in an entrepreneurial journey. Okay. So I have this liberty to ask this question. What are the set of advices as a CIO you can give it for hospital founders?
Hospital founders are entrepreneurial in nature, in a very stressful environment. As a CIO, the only request I would have is invest more, invest in people, invest in technology. I'm sure it will bring great benefit to the hospital and the patients who come to your hospitals.
So Dr. Naresh, what would you like to tell young doctors, healthcare professionals about taking up non-clinical careers?
Well, I think we have come to a stage where the Indian healthcare is seeing a lot of investment, both in private hospitals as well as in public setup. So obviously when such investment goes in, obviously they would need people to manage such organizations. So healthcare professionals, especially doctors, nurses and allied healthcare professionals, have got a lot of scope in terms of getting into such non-clinical and administrative roles, being in IT, marketing, sales, supply chain management. There are a lot of opportunities which I would see for healthcare professionals getting into non-clinical roles. The only thing what I would suggest is that get a formal education, get on the ground experience, and see where your passion lies, right? So until unless you're passionate about your job, then you will not be successful in doing it every day.
Well, thank you very much, Dr. Naresh. I enjoyed the conversation with you. Okay, and with this, I will be unplugging this Unplugged Stories with Dr. Naresh. Thank you.
Thank you.